So I know we had some victories, but we're going to be faced with this again because, I don't think we've heard the last of mandates. I feel like this is just the start. So what do you foresee as to what your next battle is going to be here?
I was surprised to hear some lawmakers debating a bill that would ban government mandates, so masking, closures, and vaccines. It was debated on the House floor this week, and we had at least half a dozen lawmakers that were willing to say, no, 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 it's too early. It's too early to ban these because we could have a mutation, we could have another variant, and, et cetera, et cetera. And of course, the red herring was thrown out there as usual. Measles. What about measles? Even though this bill had nothing to do with measles. So
I texted Michelle during the debate. I was like, and measles has entered the conversation. I mean, right. The bill was so limited to just government mandates and closures. I mean, it very much so needed bill, let's be clear, but so limited. And then we're like, okay, here comes measles,
Right. So they're willing to fight every single measure that would protect medical liberty for Texans. I mean, even fighting against healthcare access for these disenfranchised children, these complex medical children, they fought that. And it's mind-blowing to me to be able to justify such an argument, but they are so bought into this and they will come back next session and they will try. There have been the same handful of bills that have been filed each and every session over and over and over. They die every time, but God bless these people. They keep trying. They're very, they're perseverating on some of this stuff.
So who's behind them? I mean, who's lobbying them? It's not, let's face it, it's probably their politician. It's probably not necessarily them thinking it. I mean, who's talking to them?
Some of these lawmakers represent the medical districts in their areas. And some of them really do just want to die on that hill.
Wow. Well, one thing I want to say about you guys not being anti-vaxxers, same with Janet. Janet and I aren't anti-vaxxers. It's even in your name. It says Texas for Vaccine Choice. You want patients to have choice. That's all I want. I mean, my goal is to educate and empower individuals to make their own educated healthcare decision for themselves. That's it. No mandates, no must-dos. Patients should have the individual liberty to choose what healthcare services they want access to or put in their bodies.
Right. I mean, let's define what anti-vax is. Anti-vax would be an organization that is trying to tell you cannot vaccinate, remove your access to vaccines, dismantle the vaccine program in America. You will not find one bill that we have filed or support that does those things. And, let's be clear, those bills would never get filed because it's politically advantageous. But we would not even, this is fundamentally a liberty issue. And if we are telling somebody that they cannot vaccinate, we are no better than the yahoos trying to say we have to. And That's just, they might think I'm stupid for not vaccinating. I might think they're stupid for vaccinating. Guess what? We have the freedom to be stupid, that's it. Now, let me tell you this, though. We do fundamentally believe that the informed consent surrounding vaccines is wholly lacking. And that is a gross disservice to every single citizen. And that is one of our cornerstones of our mission statement, is to advance informed consent, because that piece has just been fundamentally missing. And, what other preventative measure do you have to do this huge bureaucratic opt-out just to get an exemption for it? And, you don't have to appeal to the state to get a magical form to not get a colonoscopy or a mammogram or a pap smear or anything else, these other preventative measures. Why we have to go through this whole rigmarole around vaccines, it's ludicrous. But, and so that's fundamentally our goal, is to make vaccines completely irrelevant to your participation in society. I mean, it's one of the biggest hat tricks that Big Pharma has done is convincing Americans that, my vaccine won't work unless you get yours. Like, what in what world is this okay? Like, it's like,
Right.
I have my umbrella today so you don't get wet. I mean, I'm taking allergy medication so you don't get the sniffles. I mean, it's just so absurd, that this is even something we are still having to fight, but yet, so I just wanted to paint the picture of like what our ultimate goal is. Like,
Right.
there's freedom here. There's here, like you do you, and we're not telling you not to. Hey, here's some information you might want to read before you do it, but your vaccine decisions are fundamentally irrelevant to mine.